It's at that point we want to invite into our program Dr. Cindy Prins, University of Florida, Associate Professor of Epidemiology. And as we talk about coronavirus cases peaking, we need to point out that in Florida, they reported just yesterday a record large number of cases, the most ever for the state of Florida, and new hospitalizations rose 1.9%, now 13,574. It was the biggest single day increase, 256 additions to that total 13,000 plus number in a month. What do you make of all of this, doctor?
Well, it's a concern for sure. I mean, we've been seeing a steady increase in cases over about the past 3 weeks. At first, you look at that and think, well, maybe we just have a blip. Maybe there's some reason that goes beyond increased transmission. But, at this point, we can't say that this is just increased testing or that this is some sort of artifact of testing. We have to recognize that we have widespread transmission of COVID-19 in Florida again.
Dr. Prins, it's Julie here. So what needs to happen? I know that the governor has now sort of come back around and encouraged people to wear masks. Does there need to be mandated mask wearing? Does there need to be a rollback of some of the openings that have been happening? How do we get the numbers back down?
Right. Yeah. So, number one, we know that transmission of this virus is primarily through aerosol droplets and also through respiratory route. So when people are coughing and sneezing, when people are talking and breathing hard, those are all potential ways that they can transmit the virus to other people. And so those masks are really critical. We need people to be wearing masks that protects themselves, but we need everyone to wear it because you have to protect yourself by wearing it and protect other people by wearing it as well. So it's a two-way street. And so what we really need is to start to get some mandates for mask wearing in the state if we really want to take control of these cases.
Well, you talk about mandates because it is haphazard across Florida. Miami-Dade County, they request you to wear the mask, but not in the other parts of the state. What are you seeing as far as the age breakdown? Because there's this whole issue of nightclubs being allowed to stay open. What did the breakdown tell you about that?
Yeah, what we're seeing right now is an increased proportion of the cases that are being identified are actually in our 15 to 24-year-old age group, and then in our 25 to 34-year-old age group. And certainly these are age groups where you expect them to probably socialize more and be going more to nightclubs and bars. And then also what we're seeing just sort of anecdotally from reports in the news is that we've had a few outbreaks that have been associated with people at bars. And when you go to a nightclub, when you go to a bar, it's not realistic to think that people are going to wear masks. And then you put alcohol in the mix and, social distancing is not going to be maintained at those establishments either.
Jared Blickery here. We're in the dead of summer right now, not exactly flu season. What happens when we get to the fall, when we get to the winter? Do we have accelerated risks at that time? And what kind of behaviors can we look for or should we be trying to enforce at that time?
Yeah, that's a great question. We're very worried about flu and about the potential to have both coronavirus and influenza virus circulating at the same time. And, the problem there is that you have potential for many more people to become ill, and then you have potential for hospital resources to be stressed because of that level of illness. And so, we really need to at least try to get coronavirus under control, get these cases down before that point. And then we also need to have flu vaccine campaigns really emphasize the need for that flu vaccine, the importance of getting it so that we can try to minimize those cases as well. And the other thing is that, all of these precautions of social distancing, of wearing masks, and even of enhanced hand hygiene and enhanced cleaning, those are protective against flu as well. So if we can get people to get on board with those, then we can prevent both of those viruses.
Dr. Prins, when I think of Florida, I think of vacations, I think of tourism, and I'm at the point right now, I'm talking to my husband, and we want to be responsible. So what should folks think about if they would like to travel? Is it even possible to go on a vacation, or are we better off just kind of staying in place?
My personal feeling is we're better off in staying in place right now. I think the issue is, you don't know what's going to be happening in the area that you're going to vacation to. You may be making a plan right now, but a month down the line when your vacation comes around, you may see an explosion of cases in that area. You also have to think about the fact that when you vacation to a certain area, you put extra stress on that healthcare system. So if you become ill, you become an additional person that maybe wasn't going to be accounted for before within that healthcare system. And then for your own personal benefit, you have to think about what happens if you do become severely ill in another location. So, is your insurance going to pay for your hospital care? How are you going to get back home? How long are you going to wind up being in this place while you're ill? So those are all things to consider. And my recommendation right now would be stay closer to home, enjoy the things that you can in your own area, and put that vacation off until later.
Dr. Prins, just wanted to mention a headline that we just got from Florida that the new positivity rate jumps to 15.9% from 10.8% a day ago. So the rate of positive tests among the tests that are being done in Florida. You mentioned the concern about hospital resources and capacity, particularly going into the fall. But where does Florida stand right now as we are seeing this acceleration in that positivity rate? Are the hospitals starting to get overtaxed there?
We know that admissions are starting to go up. One thing with the shift in cases to the younger age groups is we know that they don't tend to be hospitalized as often. And the death rate is not as common in those younger age groups. But in saying that, I also want to emphasize that, as you get more and more cases, even if those occurrences aren't as frequent in those groups overall, you're still going to get more people admitted because you're just going to get a huge burden of cases within those age groups. And those folks can still get very, very ill. They can still die. And we really don't know what the risk factors are for some people who get ill. We see people who seem perfectly healthy and they wind up hospitalized on a ventilator and then sometimes die as well. So, that's a concern.
So, Dr. Prins, what would you say to Governor DeSantis about getting ahead of this?
Well, certainly, I think that we need to understand what the risks are with the reopening. I think that there can be a balance in having some things open, but then also needing to put a little bit more control on other activities. And, if we're seeing that there's a risk of going out to bars, going out to clubs, not socially distancing and not wearing a mask in those cases, then we need to think seriously about whether those establishments should remain open. And then the other part of it is, I think in some cases we really need to go beyond just suggesting that people should be wearing a mask or recommending it. If we want to control those cases, I think that we need to start mandating that people wear masks in public.
Dr. Cindy Prins is a University of Florida Associate Professor of Epidemiology. Thank you for joining us on The Move, and go Gators.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.